I was really excited to talk with you on a few different things,
Yep.
partially out of frustration,
Yeah.
because as you know, Keeley isn't the only B2B that we work with in the St.
Yeah.
Louis area, and so many others don't get it. Like they're fine, they're busy, they just need to show up for work. That's my biggest struggle.
Hmm.
So I thought, well, who do I know who's doing it well and right and makes it look seamless and easy?
You
Who,
give me too much credit.
well, I got questions, sister. So
I love it. I love
yeah,
questions.
it's good. So I wanted to for us and to share and to work with just because I think our industry, our blue collar, our white collar, who cares whatever color you wear,
Yep.
we need to take care of our people.
Yes.
We really need to take care of our people, and I think so many people are missing the mark in
Hmm.
in St. Louis and in the world, really. And so I want to see what we can do to help them.
Yeah. For
So I want let's start tell me a little bit about yourself, what you're involved with, who you are, what you do, so we have that simple background for this.
Absolutely. So, my background is in public health. I have a master's degree in epidemiology, and I'm a nationally board certified health and wellness coach. So,
Mhm.
I bring with me a lens of evidence base, of using the research and the data that's out there to inform decisions, processes, ideas, all of that.
Mhm.
I also try to come at it from the lens of the health and wellness coaching, to better understand, what we're trying to do. And I think this speaks to the first thing you mentioned of there are a lot of companies out there that sort of see this as, people aren't coming here to be well. They're coming here to get a job done and then go home, right?
I
So
just need more widgets. I,
exactly.
I don't care what they do, how many beers they drink on the weekend, how
Yep.
much, who cares if they don't exercise? I just need more widgets.
Exactly. Yeah. So, certainly I've come across those companies in my path, and I'm one person owning one company. So I tend to not be able to work with all of the companies.
Sure.
And certainly, on the adoption curve, the standard bell curve of adoption, we have early adopters. We also have some late or non-adopters on the other end. And my goal is to really work with the people who haven't already done something but are still interested or open to change. So it's that general two standard deviations off of norm,
Hmm.
um, that don't involve the people who are never going to change and then who already have also done it exceptionally well. I'm obviously willing to support, but the idea is more so how we reach people who haven't yet gotten there and create change for them. And,
Yeah.
I think it's a struggle because we still, especially being where we are in the Midwest, I think there's still this mentality of, well, what's my ROI? How am I going to financially
100%.
benefit from implementing this? And it's a real challenge because you're not asking someone to incorporate something into their job description and take that on, and that's a measurable outcome. You can hold them to that. You're asking someone to change their behavior, to change something about themselves and who they are, to improve their health and well-being, because you know that that will not only benefit them, but there's a lot of research, which I'm happy to include. I won't spout it off right now, but there are data out there that say that when people are more engaged and do focus on health and well-being and they feel supported by their company, there actually is an ROI. And it's something
Yeah.
like every dollar spent in a targeted wellness program, you get about $3.27 back
Yeah.
return, right?
Yeah.
So it is a substantial versus a non-targeted generic wellness program, which is closer to a dollar 25. So pretty break even, right? So I could understand why some companies are not necessarily interested in putting all the time and energy and investment in something that they don't see a benefit in. But really, when you're talking about behavior change, we're also asking people to invest in themselves. And as a result, they get to invest in the company as well. So that's certainly something to think about. The other part of it is that as a company, you are not looking for an ROI. You have to change your perspective on what you think is success, right? So from a company investment standpoint, we have to look at this as investment. We don't look at training and say, okay, well, we trained these 25 people, so we're going to have, a $1.25 for every dollar invested back on these people. But we are kind of trying to do that with these health outcomes. So
Yeah.
really, how do we shift that conversation into a conversation about investing in your people so that they excel and become better?
In, I guess, I mean, you're right. It's such a big, I'm going to use philosophical, like, because we see it being in the healthcare world of looking 30,000 foot down and be like, it makes so much common sense for us to be like, all right, well, listen, are you taking out the soda machines and putting sparkly water stations in?
Yeah.
Like, we can see these things from a 30,000 foot view, but if all you know is this is the process, this is like at the end of the day, it's what it is, but people aren't working in industries that aren't supporting them for years on end. That big question is like, shoot, I was talking with somebody yesterday. Like the days are gone when you worked at one job for your entire life.
Yes, yes. It's really what is my next step, right? Like
Yeah,
what will
yeah.
what company will support me in achieving my goals? And really
Mhm.
the new draw is how do we symbiotically work to support each other versus, gosh, I hope I get this job and I'll just stay there forever, right? It's how will this move
Yeah.
me forward in my career trajectory? And from a company perspective, offering a comprehensive wellness program, something that reaches people to engage them in their own health and well-being, is also a real incentive for, this current market, for driving employment.
Okay, so again, you make it look easy. We we know it's not.
No.
But where does like okay, so the people who may watch this may not watch this who are like, okay, listen, I think I probably should do something.
Yeah,
Like, where do I start? And like again, how easy is this to set up for me? Like, listen, I don't
yeah,
want to do anything. Do we just hire Melissa and just let Melissa do all of it?
yeah.
Or can we do little things on our own? Do we bring in a dentist for the dental thing and let them do a little cavity screening? Like, how easy is this to set up for people?
Yeah. I mean, there's a couple questions to ask as a company as you're thinking about getting this started. First of all, what are we already doing?
Yeah.
Um, a lot of companies offer things, and I'm going to throw some numbers out there, but of the companies that offer EAP programs, so about 95% of companies over 150 employees offer EAP programs, but that utilization rate is about 3 to 5%. So
Ooh,
that,
oh,
yeah, right? So we're
oh. What?
paying
Why even have it? Why even
exactly.
have it?
And it's awesome and it's an expectation, right? But nobody's using it. So what's that barrier? And that's part of what I do when I work with companies is to help them understand what is getting in the way of people using the things that you already use and or already offer, excuse me, and then what gaps are in existence, right? What types of things are people struggling with that you don't cover or don't offer assistance with or that sort of thing. And then figuring out what does a wellness program look like for us? How do we individualize wellness for our people? It's not, I think that's the difference between working with someone like me and working with a generic wellness company is that's sort of an out of the box program. Not that those are bad. If your company finds that that resonates and it's easy and people will use it, that's fantastic. But I really struggle with the idea of spending more money on things to offer that people still aren't going to use, right?
Yeah, yeah, totally. It's just like, okay, if like we don't want the yoga classes, like we're good.
Yeah.
Be like, okay, well, why are we spending money and resources on offering those yoga classes if ain't nobody going to use it in the first place?
It's interesting. So you might know this, but I got my yoga certification about 15 years ago. I'm an ERYT registered yoga instructor, and I've been doing it for years. And I would love for everybody to do yoga. I know that yoga is fantastic, but I've stopped suggesting that companies offer it because it sounds great. But when you ask the employees, would you like yoga? They'll say yes. And then you say, well, when would you want to do yoga? And they say, well, maybe early in the morning, but I'm already getting up so early, I probably wouldn't come in earlier. Or midday, and then when you dig deeper, they're like, well, that's when I take my lunch, so I probably wouldn't want to do yoga instead of eating. So what happens is you start to get the real story, which is it sounds nice, but people aren't actually going to use that. And if there's somebody on here or somebody who listens to your podcast and says, no, 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 my company, they do yoga, that's
God
great.
bless them. God
Awesome.
bless.
And I love that. And there are some companies where people are excited about that and it should totally be offered. But again, that's part of tailoring your wellness program to your people
Yeah.
versus deciding what would be nice to have and doing it and then wondering why nobody's coming, right? So the real as you're starting to think about a wellness program and what do you need to do to put something in place, you really need to think about what do our people want and
Yeah.
need,
Yeah.
and what will they use, and how will they use it, and will we, how are we hoping that that will impact change, right? So what are we
Yeah.
hoping will happen as a result of doing all these things? It's so easy to offer something here or there, but as someone that implements these, really having ideas of like where you want to go with it, that's a big deal. For someone that's starting and just wants to implement something, follow me on LinkedIn through the Wellbeing STL. I frequently post ideas or suggestions on what you could do in your own company to increase engagement or to potentially look at an opportunity or a place to get people more involved and participatory. So that's a great way. But if it's not me, find an influencer, someone that is proposing some things, and then just do one thing. And just decide this is something I want to try. Here's how we'll measure its success. Let's put that in place and see how it works.
Nice.
I'd say start small.
Okay. All right. Now, again, I agree with you. Like, just try a couple things. Ask the
Yeah.
people what they want. Like, yeah, what would you, and then I love what you said is what you would want as like drink more water initiative. Like,
Yeah.
what does that do for you? Like,
Yeah.
as like, again, think a little selfishly as the managers as HR, what would that benefit the company?
Yeah. So as an example, that's a great one. So I work with a lot of construction companies and tradespeople. And so drinking more water can have a real and direct benefit for the company as well as the individual. And I
Mhm.
can explain that. It sounds sort of ridiculous to suggest that having people drink more water. But when you are working in the field or in on location and you are physically active and working all day, if you're not replenishing, and I know you know this, but
Yeah,
if you're not
right.
replenishing your water and your electrolytes get out of balance, you start having negative or adverse effects as a result, right? So, from a job site safety perspective, suggesting that people drink more water will help reduce the job site adverse events that you have to report or reportable events in terms of people's health, or
Yeah.
someone gets sunstroke or something like that, right? So
Hmm.
having excuse me, I have itchy nose.
It's all good. Me too.
Um,
I'm with you.
as you're thinking about, doing something, it's helpful to know. I like to tell people we don't get in the car and we're like, all right, let's go without knowing where you're going, right? I
Yeah.
mean, potentially someone on this call might have done that someday and they just
Sure.
end up somewhere and are so excited. But most of us have a destination in mind.
Yeah.
And then we know when we get there because we arrive at the destination. We plug it into GPS and we go, right? So it's understandable why, as you're thinking about implementing a new strategy, that you know where you want to go before you start embarking on that journey. Because ultimately, you want to know when you get there. And if you're detouring, if you are not on that path and it's not affecting the change, you can decide, is this a good detour? Sorry for all the analogies, but is this a good
I'm
detour?
loving it. It's good. We're
Do,
good.
do we want to stay on this road? Because is this an easier path to where I want to get to? Is this changing my endpoint and I'm okay with that? Or is this diverting me and I still should be going here, but now I'm headed a different way. Let's change this. So it's helpful to have that idea in place. And that can be comprehensively determined, right? When I start working with a company at a larger level, we do a discovery process where we really triangulate the data, the conversations, the focus groups and stakeholder goals and objectives. We bring all of those together, and then we think, okay, how do we strategically create a program that addresses all the needs or as many needs as possible, resonates with the overall mission and vision of the company. So there's a lot of things that we do in order to ensure that when we start on that path, we have a clear understanding of where we're headed.
Nice. I've got notes going as we're talking. I'm a notes person. Listen, what are the last thing I wrote is what are some things you never thought of that people brought to you and like we would like to do this that you were like either like huh or like oh like what you've been in this industry long enough like what
Yeah.
are your like oh okay let's sure
I actually just met with someone last week who said they received a message that they really someone wanted to do Tai Chi for their company. And it was like, okie dokie, let's figure this out if we think that's going to be something of interest. One of the things that our champions brought up at Keeley Companies was um, someone was really passionate about volleyball and beach volleyball, which
Mhm.
I played volleyball in middle school. I'm only 5'5". It's not usually something that I think to do, but
Yeah,
I do love volleyball and I like being active. And this person was really passionate. So we sort of ran with it and it became this incredible event. A lot of people wanted to join in, and it was really led by somebody's passion and vision for making this happen. Ultimately, it was not that hard to pull together. There are spaces available, even in St. Louis, where we
yeah,
have no beach in sight. Um, so something like that, if you keep your antennae open
yeah,
to getting and being receptive and feeling the vibrations from other people and listening to the people you're trying to reach, it's a really helpful tool. I think the biggest challenge is when we believe we know what's best for other people. It's
yeah, there you go.
yeah, it's much better to ask them than to assume we know. I mean, not only is it a paternalistic approach, right? Not only is it us assuming we know better, but it also just may be an exercise in futility. You're spinning your own wheels and wondering why nobody's attending anything, but it's because you're not giving them what they want or need. You're not scratching their itch.
Okay, so one of my questions is what obstacles could be there? So I'm assuming that's one of the bigger ones.
It is, absolutely. I think another one is just, you said it at the very beginning, we don't, this isn't, this company is not about wellness. We're trying to get widgets done. We just need a widget maker. I
Mhm.
think the mentality is something that can be a real challenge. This idea that wellness should be separate from your job or a place of
Mhm.
employment. We spend about 40% of our lives where we work. So if you're
Yeah,
thinking about that, how are we not considering the health and well-being of our people when we are asking them to spend half their lives working for us? They are still human, right?
yeah,
So there's that component. The other part is just as a human being, there are things that you can just understand. So let me ask you this. Have you ever had in something that happened at work and you left work and you go home and you can't stop thinking about it? It's
well of
still there,
course it's all the
right?
time.
Totally.
Yeah,
Same thing. Something happens at home, you have a family member sick or something tragic happens, and you go to work and you are there in body, but spirit is elsewhere, right?
yep.
To ask people to parse apart their lives from the purpose of them being where they are is impossible. We cannot separate out. You can do it for a short bit of time. There are a lot of people that compartmentalize and say, I can, focus on what I
Sure.
need to focus on. But at the end of the day, are they really
I
giving the
call
100?
BS on that.
Yeah, I do too.
100%. Yeah.
It's okay. We can all compartmentalize for a short bit of time, but eh, for the most part, when your brain is otherwise attending to something that
Yeah.
is important to you, we're not giving 100% of our time and effort to the thing that's in front of you. You're thinking about your sick kiddo at home or your parent who is in the hospital, or you're thinking about a financial situation that you really need to get your hands on. So, as a company, integrating supports for that person makes them feel like, oh, my company actually does care about my health and well-being. I don't need to, you know, just show up and be absent, completely mentally absent. I have resources. There
Yeah,
are ways that I can connect with EAP or a coach, like a health coach. If I'm working with a company, I am available to all of their employees and their spouse partners to reach out to. So, at least right now, that's how I work with companies. So, having resources available is a good way to ensure that your person is getting what they need so they can bounce back.
yeah. I want to go to the complete opposite side
Yeah.
of the angle because I think it's such a cliche question to ask who would be a good fit for having an EAP. And
Yeah.
okay, describe. Can you define EAP for me
Oh,
and
of
for
course.
everybody here? I know
Yeah.
what it is, but many people might be like, EAP, who's this EAP person? Yeah,
Absolutely. And funny, I've actually worked with a company who did have an EAP but didn't know it because they didn't know what EAP stood for. So
yeah,
EAP is an employee assistance program. It's often offered as a benefit to the employees or team members of that company, as well as potentially extended family members
mhm,
like spouse and children. The service itself is typically mental health related, and it gives you an opportunity to have a mental health resource professional
yeah,
available to you. And companies often give you a number of visits for free. So, for
yeah,
example, you might get 6 visits with a mental health professional before they refer you out to someone else, but you do get those visits for whatever cost has been predetermined. Sometimes it's for free through the company, sometimes it's a markedly reduced cost um, for a mental health service.
All right, let's. I still want to ask my question, but you're so right because many of the companies, the bigger companies that we work with, are like, yeah, but it's just for like alcoholism, drug dependence, like mental health focused. How did the mental health world get ahead of the curve and get into working? Like, what was the original drive to have that as part of the benefit to the you
Yeah.
understand what I'm asking?
I do. And to be totally honest with you, I wish I knew the answer to that. I could guess, because really mental health situations can be catastrophic in a way that is not as easy to identify and treat, right? So, someone breaks a bone. We know you go to the hospital, you get an x-ray, you get cast, you're on crutches. We all can visually understand what that looks like.
Correct.
With mental health, it's not until someone has a breakdown
Yeah.
or,
It's
you know,
post.
exactly,
It's typical.
exactly. So I
Yeah.
think if I had to guess, it might be in reaction to the fact that people are not really supported until it gets to a point where really an intervention needs to happen. So,
Yeah.
yeah, I mean, the great thing about EAP programs is that they exist and that people are now more fervently using them and employing them, not only the employees, but the people who run the company and through the people ops divisions are promoting them more, which is great.
Yeah.
But the struggle is that a lot of people don't know what would constitute um, uh, a qualified mental health struggle in order to make a phone call, right? So most people are like, well, I'm not that bad. I don't have to like call a mental health professional, right?
Right.
I think there is still the stigma that you have to be completely incapacitated, right? It's not just a twisted ankle, it's that I fractured my tibia and my fibula, and now I get to, have pins in my and have surgery
Yes.
and all the
Yeah.
things. We're waiting for people to have that type of response in order for them to get mental health services. The conversation really it turns into how do we communicate better to people who need the services that they are there for you whenever you need them. And for many companies, the six, I'm using six as an
Yeah, yeah,
example.
yeah,
It's
yeah,
the six times that you can receive those services, they're based on the diagnosis, right? So if you have a conversation with them and you are diagnosed with generalized anxiety disorder, you get 6 visits with them. Well, fast forward 6 months, you go back, and now you have mild to moderate depression. Well, that's another 6 visits sometimes. So it just depends on your EAP program, but um, the the fear of I'm going to run out of these might not necessarily be founded. It's a conversation that you should have with people ops or the people in your human resources
yeah,
division.
yeah. Very interesting. Very interesting. Okay, back to the what I
Yeah.
wanted to ask
Okay.
is, all right, who is not a good fit for having an EAP or a wellness coordinator or any type of program, little or big? Who would you be like, you're good, thank you, God bless, see you later?
Yeah. Um, so first of all, the easiest answer is the company that's already doing things.
Sure.
Certainly, there's no reason to intervene and fix something that's already working well. I'm happy to advise or offer ideas or connect with companies that are eager to get even better at what they do. But those are companies that are already thriving and already have a program in place. The other side of things is working with companies that have a lot of resistance in the leadership positions makes it a real challenge. I'm not
Yeah.
saying that they should not have a wellness coordinator or a wellness program. Maybe they need it more, but to be in a company or to work with a company where leadership does not support it sets a tone that, we offer these services, but we don't actually want you to take time out of your day to use them, right? So
Yeah.
the tenor that's set by management, by supervisors, by the executive suite in a company really helps with adoption and maintenance and stability of a program.
I we were talking about this in some team meetings about risk versus reward and
Mhm.
trying new things and adopting new standards and new protocols and different things. And I'm like, all right, well, what? Okay, so we try something new. We put purple paint on the wall instead of pink, and like they'll either love it or they'll hate it. If they hate it, we'll go back to the other color. Like
Yeah.
who cares? I think I'll be open to say it. I think you're right. Too many people are just stuck with their head in the sand, stuck in the mud, and they're not willing to try things within their business. Maybe they'll try things when it comes to the production, like how do we produce more widgets? Well, we can get the XYZ machine. That'll help, right? But again, my feeling is we're in such a day and age, Melissa, where our biggest resource is our team.
Oh, absolutely.
And oftentimes we don't selfishly value the amount of time, training, education went into getting that team member to the level that of production that's required.
Yeah.
What do we need to do to keep them there?
Yeah, for sure. Or even help them continue to grow, right?
Yes.
So the obviously the continuing education side of things, but companies that are have kind of a closed mindset of no, it's working. I don't want to change anything. I heard someone say this, and I'm not going to be able to attribute the quote, but
Sure.
the quote is something to the effect of if you're not climbing, you're coasting. So
Yeah.
if you're not growing and
Yeah,
reaching,
you're dying. If you're not
then
growing,
you're
you're dying. Yeah.
exactly. So
Yeah.
the idea of this being, if you're open to change, if you're open to the idea of supporting your employees, your team members as team members versus people that create widgets, right? I think thinking about them and changing that mentality is important in that
Yeah.
regard. I apologize, the light just went out where I
Do you
am.
need do you need the wiggle move
I know I need to
for the
move my arms. Didn't work.
The company did a really good job on their on their like saving on electricity.
I
I
know,
love it. Yeah.
right? Probably looks better because now I'm highlighted from
You
the
look
front. But anyway,
fantastic now.
oh, that's too funny. You know, back to your question though, or your statement about, I think companies that have that closed mentality of we've done a thing, it's been working, so let's just keep on doing that thing, lose the opportunity to have ideas and iterate about how can we make this even better, and being open to showing the human side of their team members.
Yeah.
It's easy to come at this from a professional standpoint. A lot of people ask me about what it's like to group coach in
Mm.
a corporate setting because you're with other people you work with and you come into this room and now you're supposed to be
The
vulnerable
therapist.
and
Yeah.
open. Exactly. And a lot of people do see coaching as a little bit like therapy. Obviously, you and I know it's not, but the idea of being vulnerable is there, right? And I like to say, these people know what it's like to work here. They are aware of the culture, the environment. So they get it when you say, "Oh, I had to do this. I had no choice." And everyone else kind of nods in agreement. "Oh, yeah, I totally get that. You
Yeah.
absolutely had to." Versus when you're talking to someone outside of your company and they say like, well, why don't you just try this? Or why didn't you just tell that person that? There's a certain level of understanding that comes along with that. And it breeds connectivity, relationship building, better understanding within a company when you foster those types of
Yeah.
opportunities.
Yeah. Yeah. Um, Melissa, I've really enjoyed this conversation with you.
Oh, I have too. Thank you so much for
Yeah.
inviting.
I don't have much else. I think we're like, I think it's exactly what I think people need to know, people need to hear and understand that truly they need to invest in their team.
Hmm.
It,
For
it's it's
sure.
it's not a we should do this, that would be nice. It's a necessity.
Yeah, totally. I
It's
very much agree with you. I've dedicated my life to this of helping, trying to reach people where they are. We're already asking so much of people. Reaching people at their places of employment takes a layer of burden and barrier away from the process, right? So people are already invested and engaged and prioritizing being at work. How do we meet them there to
yeah,
ensure that we're getting information to them?
yeah, yeah. Very true. Very true. Well, Melissa, stay on for a second, but I
Yep.
wanted to say thank you for doing this with me.
Of course,
Um,
thank you.
I always appreciate any chance I get to connect with you,
Oh,
even
you're
if
so,
it's for a minute. But you're awesome, and thank you for sharing some knowledge and some wisdom today.
oh my gosh, my pleasure. Thanks so much for inviting me.
All right, cool.
Bye bye.